Cancer is not a new disease. It's a disease from the time of Egyptians and Greek civilization. As the research in cancer started from the Second World War, there has been no stopping it. And now in the digital era, we find that the diagnosis of cancer is more precise, the tumors are being identified, and also are the treatment plans. IndiGlobal Media Network Edge Factor brings research-based scientific insights from industry leaders. Today we have with us Dr. Jagprag Singh Gujral from Cancer Treatment Services International, who will talk about the emerging technologies in the treatment and diagnosis of cancer. Hello sir. What are the emerging cancer treatments in India, and how is CTSI looking at the cancer market in India?
So CTSI, as you said, let me start with the latter part of your question. CTSI is Cancer Treatment Services International. It's a dedicated cancer oncology care platform concentrating on South Asia. In CTSI, we've got an amalgamation of 4 companies. We've got a brand called American Oncology Institute that primarily is a healthcare delivery arm focused on oncology treatments. We've got a diagnostic chain called Ampath, which is a specialized diagnostic chain all around the country. We've got a Citizens multi-speciality hospital, and we've got a 4th vertical which focuses on improving efficiencies and back office operations for a lot of interventions required in cancer treatment, specifically radiation. So it's more focused on dosimetry and all, called CTSI Oncology Solutions. So that's what encompasses CTSI. You have the first part of your question, what are you seeing in cancer in India? Well, one needs to understand that oncology or cancer is a little different in terms of speciality amongst all the other specialities or disease profiles, both from a patient perspective and a provider perspective. Why it's different from a patient perspective? Because a patient does not have a single touch point to either get diagnosed or get treated or get followed up in his journey of cancer treatment. So it's actually a journey as we describe it. So from a patient's perspective, oncology or cancer is a little different, and it needs to be, the nuances which go around tackling it are a little different than most other diseases which are either acute in nature or chronic in nature with episodic rises and falls. From a provider perspective, oncology is very, very dynamic and evolving. And when I say evolving, it's evolving by the day. So things that, the learnings that you can get from the Western markets, how they deal, and by virtue of the fact that a lot of trials happen over there, a lot of product development is happening over there, a lot of process interventions, amalgamating software with AI into providing treatments is happening over there. So this evolution and getting the right next leapfrogging technologies into South Asia is a key challenge for companies like CTSI from a provider perspective when we talk of oncology care.
Okay, so what is the intervention in terms of digital healthcare, and what is being seen in terms of AI? If you could just elaborate on that.
So digital healthcare, digitalization per se is a very important phenomena in all industries as we know it today. As a matter of fact, we are sitting in the middle, according to me, in what we can call a digital revolution now. We are way past the industrial revolutions, and we are actually at an inflection point in digital revolution, especially in healthcare. Digitalization plays a key role in all facets of healthcare. Let me concentrate on oncology and explain my perspective on this to you. Most importantly, digitalization helps awareness of the common public towards a lot of subtle nuances of oncology or cancer. And I think that's the first step that's the first step of synergies between digitalization in oncology and the public at large. The more we are aware that there are, cancer is a complex disease, it's a long journey like I mentioned, but the earlier you're able to catch on to signs, the earlier you approach the right medical practitioners to get it diagnosed, the more are your chances not only of emerging successful from the disease, but actually conquering the disease. So on a preventive aspect, on a awareness aspect, digitalization plays a very key role in this specialty. Moving on to treatments and AI, as oncology is so evolving, oncology is not only limited to a particular branch of medicine. See, in oncology treatments, we've actually got a complete hospital that comes together to precisely treat a patient. So you've got pathology diagnostics, you've got radiology diagnostics, you've got medical oncologists, you've got surgical oncologists, you've got radiation oncologists, you've got nuclear medicine specialists, you've got pain management specialists. Then you've got certain diseases that come by virtue of the fact that either your immunity gets lower because of treatment or because of the cancer or because of exposure to other diseases. So it's actually the whole paraphernalia of healthcare which comes together in oncology treatments. Now when you've got so many moving parts, obviously artificial intelligence plays a very, very important role. Firstly, in coordinating between all of these specialities, but even more importantly than just coordinating, in deciding the right treatment plan and a personalized treatment plan for each patient. So that's where digitalization is very important in the middle of the patient's journey. Towards the later part, where digitalization, and this is a place that there are a lot of steps being taken by a lot of healthcare groups, both private and the government, which is digitalization of healthcare records. That's another key aspect which is really going to change the way we look at oncology. Because the moment your records are available to be sliced, diced and analyzed the way you want to, you start making registries out of them. You start understanding trends which are located by geographies, by certain demographic profiles. All this goes a very long way in comprehensive cancer management or comprehensive oncology delivery for this entire region of South Asia.
So now I come to the main point, as in terms of cancer diagnosis. And how will digitization help in diagnosing cancer? And what are the inventions or the new technologies which are coming in terms of diagnosis?
New technologies in diagnosis of cancer. So when we as providers today look at cancer treatments or treating a patient who's been diagnosed with cancer, we look at multidisciplinary approaches. And when we look at multidisciplinary approaches, our aim is precision therapy. By precision therapy, I mean that we personalize treatments, and everybody wants to do healthcare in exactly this way, right? We want to personalize healthcare and personalize oncology treatment depending on a person's genomic and proteomic profile. So that's where pathology plays a very key role, because it gives us insights on certain dynamics that are changing in the cancer cells and certain mutations, how they are going to affect, by us making sure that the treatment profile or the treatment regime that we are prescribing to patients as providers happens to be absolutely alleviating any side effects or restricting whatever other nuances happen by such invasive therapies for a patient. So that's a key role. I would say pathology plays a very, very important role in a cancer patient's lifetime, in a cancer patient's treatment journey. In terms of what new is happening, we've got all types of NGS sequencing, genomic analysis, proteomic analysis. We've got analysis which determine what is the right treatment regime for patients. We've got pathology profiling to determine how effective treatments are once they are started on a patient. How is the tumor subsiding? What's the reach of the tumor cells? So pathology is a very key branch when it comes to oncology as a treatment.
And how is the American Institute of Oncology bringing this down from the lab or from the research point of view to the hospital level, to the clinical level? And where do you find these interventions are possible in India, given the insurance coverages of the people and given the cost that is involved in the treatment of cancer? So how is the transition possible, especially in India?
Yeah. Firstly, on your question that how American Oncology Institute is dealing with cancer treatments or its patients, a lot of facets go in answering this question, right? One is how do you make sure that you take preventive screening to the masses? That's point number one, because that's the most important leverage that we've got as a country. We are a huge country of a massive population. We've got statistics on incidence and prevalence of cancer, but there is a lot that could happen if we are still able to diagnose patients early. And it all starts from the patient's understanding of what are the signs that a patient needs to look out on his own in order to make sure that he's diagnosed early, so that he's being put on an effective treatment regime. So it starts from there and it moves on to the Western concept or a developed hospital's concept of treating oncology patients, which is having a multidisciplinary and a multimodality approach. So you don't restrict a patient's treatment by virtue of a supply side constraint. So if a hospital does not have the entire gamut of all these modalities of treatment, somewhere you are restricting the best treatment for the patient, right? So American Oncology Institute, as its ethos, only believes in multimodality cancer treatment and precision medicine. So all our hospitals are fully equipped to have comprehensive cancer being delivered to a patient, and it all starts from the treatment planning of the patient. That's a very key step. See, cancer as a disease gets diagnosed, then there are nuances around the diagnosis which translate into treatment, and that's when a treatment plan is formulated. Benchmark and best operating practices tell us that a treatment plan is also debated in something called a tumor board, which has got multiple specialties. American Oncology Institute happens to, I take pride in saying that we have something called an international tumor board, where we've got doctors that wake up at 4 a.m. on a Wednesday morning for them, and all hospitals, all clinicians of our group sit down and debate the complex cases and the treatment planning that they've done for those cases to figure out the right treatment profile for each patient, at least for the complex cases. So those are levers that are put into place so that we can benchmark the treatments which are happening at American Oncology Institute with some of the best oncology treatments available for patients globally. So that's the second very important factor that I would mention in how AOI is contributing and serving our patients.
That's a very important thing, because if you have, this is something which people must know, that yes, there is a board behind which is deciding on the course of treatment. Often people feel that it is, just a set protocol through which they are treating them, and these are, I think, behind the scenes thing which happen in the hospital. So it's quite interesting. That's really very important.
Kanita, it's actually a little upsetting for me. So prior to getting into the oncology specialty, we're all multi-speciality operators, right? I personally have been in multi-speciality hospitals. What we've seen is that it's a little disappointing to see patients move from India to the Western world to get treated.
That was my next question to you.
Because if you look at it, we've got the best of clinicians which come from India.
Yes.
They're the same ones who are treating patients in most of the developed markets.
Yeah.
Today, India has got the best of technologies. I don't think we are lacking in technology in any way when it comes to healthcare, not only oncology. Where we need to put a little bit of thrust is to understand that the protocols and the processes which keep changing by virtue of a lot of product interventions that happen over here are introduced in emerging markets. Okay. And that's the bridge that we are trying to cover on by virtue of CTSI.
So how, as you have rightly mentioned, that there are, and especially celebrities, when they leave India and get treated abroad, it sends a very different message, especially for cancers, as we have seen. Now, how can this confidence level be built in, because there have been some celebrities who have shown confidence in doctors and said that, yes, we want to be treated in India, we will not go abroad. But in terms of cancer, we are realizing that most of them are opting out. So how to bridge this gap and how to bring in that confidence level? What more needs to be done?
Yeah. So firstly, we need to understand as to why people choose to move outside home territories to get treated. I think that's the question, and the answer to that question boils down to your answer. So firstly, one also needs to realize that when you're diagnosed with cancer, you always want to take multiple opinions.
Yes.
That's a good thing to do. It's not a bad thing to do. I would not encourage patients to go to Google and start treating themselves. But an awareness is very important as to what you've been diagnosed with, what is your doctor talking to you about. It's best to have that clarified from your doctor, but it's also good to go through all types of options available to understand more about your disease and treatment. So second advice or third advice or second referral or third referral plays a very important role. So one of the reasons why people leave home territory to get treated outside is second referrals, which is very justified. How AOI is trying to help patients who can't necessarily move outside home territory because of the costs involved is by offering this service to them through their international tumor board of some of the most distinguished clinicians sitting outside who anyway in all probability will not be accessible to them even if they were to land in the United States. So that's one thing that we as hospitals can definitely do for our patients to prevent a lot of unnecessary cost burden on our patients. Second, you mentioned a second reason for what you mentioned of celebrities going outside. So there are two in my mind there are two main reasons for that. One of the reasons is privacy. If a celebrity happens to enter a hospital multiple times, it always comes in the notice of the media, which is something that one wants to avoid in times which are not in your favor, right? You're undergoing not only a physical battle, but you're also going an emotional battle if you've been diagnosed with cancer, and you really don't want unnecessary intervention if you happen to be a celebrity. So I think that's one of the core reasons why we see a lot of people who can draw media attention moving outside their home territory to get treated. A third reason for moving outside is some types of cancers do get affected by the fact that we still are an infectious disease prevalent society. So, for example, bone marrow transplants and some of the cancer treatments that lead to very suppressed immunity levels, it's assumed safer to be in a hospital which is completely sanitized or be in an environment which is completely sterilized. And there are not too many options that exist for at least the general population in our country. So that could be one reason why this is happening, which I would say is still scientifically justified. But we as providers need to really do a lot to make sure that even that drain gets stopped.
That's extremely important, because then that would also bring a lot of confidence in the other patients who are going through this, and also rare cancers. Some of the rare cancers, if they are treated in India, it also means that yes, the Indian doctors, the Indian cancer providers are having the technology with them, which would also boost the image of and the morale of the people who are diagnosed with rare cancers. So now this brings us to the next question, that what is being seen at the different hospital levels from private and the public in terms of treatment of cancers, since each human body is different and there are different genetics involved. There cannot be one set of treatment for everybody in cancer, and there are different sets of treatments. To make this clear to the patient, are there also awareness camps or awareness being done in that form? Because everybody comes with a mindset that they'll either get chemotherapy, radiation, and then some medicines. But then there are also, as you explained, precision therapy, immunotherapy, proton therapy is there. So how to reach out to maximum people that yes, you can be different and you do have a different way in which you can be treated? And how does American Oncology try that?
Well, it's not only about American Oncology Institute, but definitely American Oncology Institute is one that believes in what I'm going to tell you. And like I mentioned, cancer, if it has to be holistically approached in a patient, it requires multimodality approaches. It requires a very different, it requires a lot of specialities to come together to first figure out what is the type of tumor, what is the morphology of the tumor, what is the, you need to boil down to as deep, as deep as genomics and proteomics in a patient to figure out what exactly, in addition to the grade, stage, spread, etc., what is it that the patient has got right now. Then relay back to think that what is the evolution of this in a normal scenario, and that's where a treatment plan gets formulated by all these specialties together, especially radiation, medical and surgical oncologists together, to figure out that this is what the most efficient treatment plan for this patient should be. One thing, Kanisa, that I would want to again stress is that India has the best doctors available. Our doctors are more qualified, more hardworking, more knowledgeable, and more attuned to understanding about advancements in healthcare, more up to date with their reading than you will find anywhere across the globe. So it's not the drain that's happening of patients going outside to get treated. I don't think is justified to say that it's happening because good doctors are not available. Second, the fact that today India offers the most advanced technology in all specialties of medicine. I don't think there's a single specialty that's missing out on the fact that if you can achieve a certain quality of treatment or diagnosis through a differentiated product or a leapfrogged technology product, it's available in some form or the other for all societies in South Asia. So even that's not one of the I would say that's something that most hospitals are aware of, and a lot of work is happening around the supply side of healthcare to make sure that accessibility of these technologies is there for patients. Now, on your question of how this all comes together for a patient, is that the genesis of treatment of cancer has to be a collaborative approach. It's not an independent approach. We typically, when we study clinical medicine as doctors, one curriculum that we are not taught when we become clinicians, but which we are very robustly taught when we turn over into management or when we turn managers, is the value of consensus building and collaborative thinking. Oncology as a specialty it's very important to have that collaborative thinking when you're formulating a treatment plan for a patient, because that's when multiple minds sit together, draw out a treatment plan and discuss the treatment plan with a different set of clinicians who either concur or provide edits on that treatment plan. And that's how we and most providers approach treatments in oncology.
Yeah, that's extremely important, because consensus and collaboration has shown that most of the cancers can be treated, and also there are this whole thing about some patient not being happy also can be tackled in terms of explaining it to them that yes, this is what is your treatment and this is what has been done. Now we come to the next thing. What is it in the next decade that we see in terms of the emerging cancer markets in India, and how is CTSI looking at it?
So CTSI is a part of Varian Medical Systems. Varian is perhaps one of the largest oncology technology companies globally. We roll up into a vertical of Varian called multidisciplinary oncology, and you'll relate to that by virtue of the name. We believe in multidisciplinary care in oncology. In terms of what new is happening, a lot of interventions, product developments, diagnostic technologies, all this is like I mentioned, it's not only evolving in the West, but it's being adopted in emerging markets to make sure that what you're offering to the patient is the best that he could get in terms of all the knowledge that is accumulated globally. So that's something that that really stands out today. And this is a global phenomena that we as clinicians we want to provide the best care for our patients, right? We want to give them the best options for treatment, and these best options only come if you are aware and there is adequate bandwidth for you to propose this and deliver this to your patients. So that's what's happening at CTSI in South Asia when we talk of delivering healthcare to patients, delivering oncology care to patients. In terms of newer technologies, we've got technologies that are getting, that are getting refined, that are getting, that efficiencies pouring into technologies. They are getting amalgamated with AI. There are a lot of process interventions in addition to product interventions which are happening at CTSI through its parent company, Variant Medical Systems and Multidisciplinary Oncology, which go a long way in easing out this treatment for patients. See, Kanisa, formulating a treatment, having the bandwidth to give that treatment is one aspect. Giving that treatment consistently for 6 months or 6 years, as the case may be in cancer, is also a very important part. And like I mentioned, it's not only about the science behind this treatment. Of course, the science is paramount. It's also about the emotions behind this treatment. So we stand with a tagline which we often use in American Oncology Institutes is, "We journey with you." And typically that's something that all of us, 3,000 odd of us colleagues who associate with American Oncology Institute truly believe in, that if you have to help a cancer patient out, you have to be a part of the journey that he's undergoing, both when he's down emotionally, or when you've seen the suppression of a cancer and there's joy. You need to be with the patient in the whole journey. Those are the process interventions I'm talking about.
So I think, as you just explained, it's like there is a whole family along with you to fight cancer, and that is what American Oncology Institute is doing.
Yeah, we are trying to do just our part in this patient's journey. And before you close out, I would just like to stress on the fact for all cancer patients or anybody who diagnosed with cancer, that today most cancers are treatable. You can conquer most cancers, but what is most important is the entire paraphernalia of your family, your friends, your colleagues. There needs to be an awareness amongst everybody, and these are all your assets in this fight. American Oncology is just another asset which will always journey with you in these bad times when you've been diagnosed with cancer.
So one can also say that yes, there is a helping hand out there, and one can always just pick it up and move on with it.
Absolutely.
Thank you so much, sir. Yeah.
Thank you.
Cancer is a journey, and to treat it, if you have your family along with you, it is nothing but a boon. As we see, Dr. Jagprag Singh Gujral has explained that treating cancer along with family members who are your doctors, clinicians, caregivers, this journey can actually help you conquer cancer.